My name is Sean Stoltz, and my research deals with using social media to advance health information technology. Social media can be defined as forms of electronic communication, such as websites for social networking and microblogging, through which users create online communities to share information, ideas, personal messages, and other content, such as videos. Current social media usage in the US is 67.4%, and estimated to grow to 71.5% in the next 5 years. As far as patient portals, in April 2018, only 52% of patients were offered online access to their records, and 28% actually viewed them, mostly just once. Of those using their portals, top reasons were to get lab results, refill prescriptions, or make an appointment and message their provider, but they did not come back. So we can see here that there is a large area of opportunity not to simply increase EHR adoption, but to increase continued engagement as well. My research will help uncover barriers to adoption and provide possible solutions to these problems. My research questions are: what is the correlation between social media and health information technology? Why are individuals more comfortable sharing health information on social media than through health information technology? And what can social media data tell us about the health of individual users? The significance of this research is that it will help with the development of EHR platforms, which will increase patient adoption and engagement. It'll allow for a more holistic view of patients' health and improve patient diagnosis and treatment plan. My main findings are that individuals who engage in social media were much more likely to engage in health information technology. A study done by Jonathan Huseman found that individuals with self-perceived poor health were more likely to share and view health information on social media. When communicating with physicians, however, the majority chose text messages rather than social media channels. Even though half of these young adults were sharing or viewing health information on social media, less than a quarter of them wanted to join a patient portal. Since individuals who use social media have a higher likeliness of adopting to patient portals, efforts should be made to create interactive features and interfaces which mirror those of social media platforms they are used to. This will help support the transition of those individuals who solely use social media to patient portals, which will provide more of a benefit for providers and allow for better participation of the patient in their own care. My next finding is that patients are more comfortable using social media because it satisfies their self-management competence enhancement and social relationship enhancement. Self-management competence enhancement is an individual's ability to handle their own health, and social relationship enhancement is their ability to build their social networks to satisfy their emotional needs for social relationship. Patients prefer using social media because it allows them to satisfy both factors through interactive tools provided by social media platforms. Users are not just viewing information, they are actively involved in the sharing and exchange of information as well. This means that by incorporating similar tools into a patient portal, there will be a higher likelihood of not just adoption, but also continued patient engagement. My final finding is that social media usage, as well as the amount of social media platforms used, can assist providers in diagnosing a patient's mental health issues. A study done by Brian Primek identified that there is a linear correlation between the amount of social media platforms used by an individual and their likelihood of anxiety and depression, therefore showing that a patient's social media usage can not only tell us more about the patient than they themselves realize, but it can also aid in forming a diagnosis and treatment. These individuals were able to recognize that they felt anxiety or depression. However, they may not have been able to identify the effects that social media had on them, because they were most likely also using social media to alleviate these symptoms. Had this information been part of their EHR, the provider could take the proper corrective actions and identify an issue which may go unidentified until presented in a more fatal way. The implications are improved adoption of patient portals, integration of patient social media usage patterns into their EHRs, more confidence of providers to recommend patient portals, and improved sharing of health information between providers and patients. So in summary, social media usage and smartphone ownership continues to increase while patient portal adoption continues to decrease. By incorporating the tools which drive social media engagement into patient portals, more effective EHR systems can be developed to increase adoption and continued engagement. And finally, by linking a patient's EHR or patient portal to their social media account, providers will have access to data which can tell more about the patient than they may know or be willing to express to their doctor directly. Thank you.